We're now going to hear from Stéphane Mitchell, who's from Switzerland, and she's the co-founder of a parents group, and she's the Women's Human Rights Campaign Switzerland organizer. So thank you very much for coming to speak to us, Stéphane.
Today I'll start with a short presentation of the new Swiss section of WHRC, and I'll give you a few words about the Swiss idiosyncrasies because it's important to understand how Switzerland is organized politically. And finally, I'll give you a brief presentation of what we know about the situation for gender questioning youth or trans kids in school, and as well as the medical path that they're following. So last December, a new self-ID law was passed in the Swiss parliament without any public debate and with very little media attention. As you can see here, that's the article that came out in Le Temps. And the Swiss German newspapers, the major one, did not mention it. So the law, everything that's Swiss is always German, French, and Italian, but I'm telling you what it says. It says the law allows anyone over 16 to self-ID and modify their official sex without any parental authorization. Minors under 16 will be able to change their legal sex, but they will need parental approval. So the passage of that law was applauded by trans activists, but they were not happy about the age limitation. And so Transgender Network Switzerland, which is the national association, is now on their website urging minors under 16 to contact them if their parents are against them transitioning legally, to advise them on how to get officially emancipated from their parents quickly before the new self-ID law goes into effect this spring. Because they say after that it will be too late. This means that they are urging children to go against their own parents while claiming all the time that parental support is key for trans kids. So following the laws being passed, a group of women from Switzerland and abroad, all living in Switzerland, organized to form a Swiss WHRC section. We wrote a text alerting to the potential dangers of the self-ID law regarding women and girls' rights, and we asked for a public debate about this new law. We published it in English, German, and French on our Swiss WHRC page. And I'm using this opportunity to say if anyone in Switzerland is interested in joining us or exchanging with us, please contact us. I put the email on the PowerPoint. And if you know anyone in Switzerland and you think they might be interested, you can direct them to this talk or the one that we were featured on January 2nd on the Women's Declaration YouTube channel. Join us at switzerland@womensdeclaration.org. So Switzerland, before I tell you about the state of things for gender questioning youth, as we know them to be in Switzerland, a few words about the specific. So it's a confederation of cantons, which can be quite independent from each other. Notably, the school system and the health systems are not centralized. So there is not one JIDS like in the UK, the way I understand it, but a handful of different cantonal hospitals, health checkpoints, and clinics which offer gender-related services. Another specific is that the country is divided in 4 linguistic regions, and this makes it very complicated. Communication, organization, and research are hard to do because, for instance, we don't even read each other's press or media if we don't speak each other's languages. So it's tiny, but yet it's like 4 little countries working together. So in order to prepare this presentation for you today, the women of WHRC and I had to combine personal research, information, looking at newspapers, and direct testimonies. So I want to just state that this presentation has no pretension of being exhaustive. We are giving information we gathered to the best of our understanding and knowledge. And also we came late to the party, so now we're trying to catch up now that this law unfortunately has been passed. And I also wanted to say a few words about Switzerland and SOJI, the sex orientation and sexual orientation and gender identity, because the guidelines for the LGBT and trans associations that work with the schools are based on official commitment made by the Swiss government. In 2010, Switzerland committed to respect the recommendations of the Council of Europe on measures to fight discriminations based on sexual orientation and gender identity, or SOJI. It includes commitments to prevent SOJI discrimination in schools. It also asks to provide objective information with respect to sexual orientation and gender identity. And I don't know what they mean by objective, but obviously objective is becoming subjective as we understand it. They also ask to provide pupils and students with the necessary information, protection, and support to enable them to live in accordance with their sexual orientation and gender identity. And the Council of Europe's recommendation also states that the measures should take into account the rights of parents regarding education of their children. As I will tell you in a little bit, this is not so much respected, in our opinion. In 2015, Switzerland also ratified the International Day Against Homophobia and Transphobia Valletta Declaration of Intent, which also has commitments on doing prevention of SOJI discrimination in education. But as we all know, Switzerland also ratified CEDAW, like many countries, and CEDAW is the Convention on the Elimination of All Forms of Discriminations Against Women. I posted the Article 1 of CEDAW because it really clarifies what discrimination is. And what we all know, I think today in this chat, is that CEDAW and the commitments to combat discrimination against gender identity specifically sometimes come in conflict. So we should always remember that, at least in Switzerland, we ratified CEDAW, and this is not really working out with the Council of Europe's recommendation. So now, school guidelines. So most Swiss schools seem to get their information and guidance from nonprofit associations like Transgender Network Switzerland, or TGNS, which serves as a centralized information center of all the trans questions. And there's other associations like Agnodis in the French-speaking part, or other local associations. There are many associations. Agnodis was founded 14 years ago, and it's the official partner of the Departments of Education, both in the canton of Vaud and the canton of Geneva. And the partnership is about training headmasters and teachers about gender identity and how to handle trans youth, and to intervene in schools to inform and explain. And they also intervene non-officially, apparently, in other French-speaking cantons. And in the Swiss-German part of Switzerland, TGNS is the partner of schools. They work, for instance, with the equality exhaustive. It mentions how they inform, exchange, and explain what it is to be trans to the teachers and the students, how they intervene to surround the students, to organize information sessions and the coming out of the students, how they can help work out the logistics. And the logistics means toilets use, changing rooms, and sleeping arrangements on school trips. But they don't go into detail in the brochure about what that means exactly. They also explain how teachers might recognize a transgender student. So I posted the list, it's quite long, I'm not going to go through all of it, but when you go through the lists, once it's on the YouTube, you can pause. You can see that some of the traits described can also pertain to gender non-conforming students, for instance, and the students who could be gay and lesbian. Other traits could pertain to students who might be going through a difficult adolescence, problems at home, and these kids would need counseling. And for students who exhibit most of the most worrisome behavior, this could, such as body cutting and self-harm, this could be linked to suffering from psychological or mental distress or mental illness that need to be addressed seriously before diagnosing any gender issue. Notably, self-harm and anorexia can be lethal behaviors. The kids can die from it, and this should be attended to by medical professionals. So the brochure does, they don't mention that, they say that these traits don't necessarily mean that the student exhibiting them is trans, but they don't mention anything else. They don't say the kid could be gay, the kid could be suffering from mental illness. And one thing that I pointed out in orange, which is really strange, is that they say if a teacher noticed an absence of libido, which one really wonders in what circumstances a student would share this bit of information with anybody in the school staff, even the school nurse. So we therefore know that what we hear from trans activists is that being trans is not a medical condition, but yet they are alerting non-medical people in how to diagnose, in a way, self-diagnose what a trans kid seems to be like. This is a little summary of what we know about what's happening in the schools. And like I said, it's not centralized. So every school might work differently, depending on the canton, whether they're public or private. But we know that in the public system, the schools affirm the gender identity of the students. Names and pronouns are changed. Sometimes parents are not informed about the child's social transitioning in school. We know of at least one instance when the parents were not informed that an LGBT association had organized the public coming out of the school, of the students, sorry, to their peers. We know that toilets use is according to the preferred gender. Changing rooms can also be in accordance to the preferred gender. It depends. We've seen on the media that kids use the preferred, the changing room of their preferred gender, and some kids don't. So it's not always automatic. What we don't know so far is what's happening in terms of the single-sex sports practice or competitions. And we also don't know whether the other students' parents are informed about students using opposite-sex spaces, nor if the other students' concerns or their parents are being addressed by the schools.
Stéphane, we're going to have to stop now.
Yes, okay. So I'm just going to quickly, too bad, I wanted to talk to you about dogs. I'll come back. I just want to mention the New Parents Association, which is about finding alternatives to the affirmative model. And you can contact this association at info@rogd.ch. Thank you very much.